I talked about PET scans. As a nuclear medicine doctor, well, we do a lot of studies, but the chief among those would be a PET scan, which is very useful for cancer imaging. And I talked about its appropriate use in the most common cancers and in early stage disease and in late stage disease. My main message was PET scan, since it's not an inexpensive procedure and it involves a lot of manpower to perform the study and to read the study, should be used appropriately, meaning for those patients only which will be able to use the information in order to properly treat their disease. Those are the patients who should have the PET scan. I think the main challenge for a PET scan, at least in Manila or in the Philippines, is that there are those patients who need the scan because they have bad disease, but they cannot have the study because the scan is expensive. And on the opposite end, there are those patients who may not need the study, but because they are able to afford the study or they have third-party payers, they get the scan anyway. Well, I hope that there will be more PET scanners in the country, and so that it can provide less expensive scans for patients who truly need it. And that will mean the government taking more part in nuclear medicine studies, not just the PET scan, but other nuclear medicine studies, meaning presently state insurance system is paying for this nuclear medicine studies, PET scans included. And that means that it becomes more expensive for patients who, for a lot of patients.